Hello everyone, I'm Kimberly Parker, Executive Director with Sierra Nevada Memorial Hospital Foundation, and I want to welcome you to Doc Talk. Doc Talk is a short program where we try to introduce some of our local physicians to you, our viewing audience. Thanks for being with us. Today I'm joined by Dr. Nathan Claydon, who is a hospitalist at Sierra Nevada Memorial Hospital. Welcome, Dr. Claydon.
Thanks so much for having me.
Well, we're going to learn what a hospitalist is, but before we do that, let's just get a little personal information about Dr. Claydon. Why don't you tell us a bit about yourself?
Sure. So I'm actually from Nevada County originally. My folks came up from Orange County in 1980. My father's a family practice doctor here, opened a practice back then. I was born shortly thereafter. So I'm a product of the Grass Valley school system. I went through Bell Hill and Hennessy and Scotton, Gilmore, and graduated from Nevada Union High School in 2000. Came back to the area 2 years ago with my wife Elizabeth and started working as a hospitalist here at Sierra Nevada 2 years ago.
And you have two children?
Got two little kids, yeah. Eloise is 3 and my son Finn is 1.5. He was born here last year, just down the hall here actually.
Well, remind me to thank your parents for helping us to fulfill the physician population here in the area. Sure. We're so happy about that. Sure. But why don't you take a minute? A hospitalist is something that, many people didn't grow up with hospitalists in a hospital and they don't quite understand it. So what is a hospitalist?
Yeah, great question. Thanks for the interest in it. So it is a relatively new term, a new specialty, if you will. Originated in the 1990s when, for a variety of reasons, primary doctors stopped coming to admit their own patients. So at that point, the hospitalist term was born, and that is a doctor that stays in the hospital all day long. So you essentially have 1 or 2 doctors here 24 hours a day watching over the patients.
And you go into the rooms and you're kind of doing their day-to-day care while they're in the hospital, correct?
Correct. So pick your analogy. I'm a boat guy, so I like to use the captain analogy. So my responsibility is coordinating the care between any subspecialists. So if you have a heart problem, I talk with the cardiologist. If you have a kidney problem, I'm talking to the nephrologist. Coordinating care with the nurse and the physical therapist and the speech therapist and the case manager when you're going to be discharged, and then ultimately your own primary doctor when you're ready to be discharged.
And you do both admitting and discharge, correct?
So we work on a week-on, week-off schedule, which allows us to hopefully be in charge of your care for the majority of the time. So a lot of times, yes, it's true that I will both admit and discharge a patient.
And I think a lot of people really wonder how you interact with their primary care physician because, again, many people grew up thinking their primary care physician would come into the hospital if they were here.
Yeah, great question. So we have a fantastic group of primary care doctors here in town. So that's real important for our care. So when you're admitted, we get as much information as we can from your primary doctor. That helps us treat you the best we can while you're here. And then when we discharge you, our job is to coordinate getting you back to your primary doctor who knows you the best and to have the best success when you're discharged.
Wonderful. And do you go into other areas of the hospital like ICCU and other places?
Sure. So we have a number of floors that we go on. Medical surgical floor, the telemetry floor. Our doctors are qualified to treat ICU patients. We have a 10-bed ICU here at Sierra Nevada. So we admit and treat most of the patients in the hospital.
Wonderful. And how many of you might be on at any given time, and what does your group look like?
Yeah, good question. So on any given day, we have 4 full-time doctors during the day, so 7 a.m. to 7 p.m., and then 1 doctor's here at night. So we have 24-hour coverage.
Wonderful. And it's sound physicians.
Mm-hmm.
And, for a lot of people that don't know, it's a physician group that works at the hospital because in California, legally, physicians can't work for hospitals.
That's right.
Couple quick things. You're the chief hospitalist. So what does that mean? What's that different?
Yeah, good question. So part of our group's importance is coordinating with the hospital and delivering the best care and quality that we can. So that's part of my job is to make sure that that's what we're doing.
And I just have to mention, because Dr. Claydon won't, he's a humble guy, but he has just received 100% on his HCAHPS scores, which is a patient satisfaction survey,
That's right.
which means that 100% of the people that responded to that service rated you as 100%. That must feel pretty good.
Well, it's a team effort, so it's the nurses and the facility and all around is part of it. So.
Well, I think what it shows our community is that people are very satisfied with our hospitalists when they come into the program or come into the hospital. So, I want to thank everyone for joining us for Doc Talk. My name's Kimberly Parker with Sierra Nevada Memorial Hospital Foundation, and we'll look forward to talking to you next time. Thank you.